been exciting, exhausting, and but basically what we've been working for 10 years was to get in a position to be ready. And then when our country called on us and we delivered, it's just a terrific honor, and it's a great experience to work with all these other wonderful people, our staff, who put up with the risks and who were very professional and very caring. I think this gave us something we could do constructively to help medicine in the United States. It helped these other hospitals that are springing up. The government wants a string of hospitals that they can, not just 3 hospitals they can count on, but they want 40 or 50 that are able to take every Ebola or avian flu or whatever comes along. Because you had this experience, and even if we someday get back to being normal in terms of the units, I think we're always going to remember this. But I think since we're involved, at least for the next 5 years, in educating the country, we're involved in some research, and we're one of the, I think, the go-to hospitals. So if there is another Ebola outbreak, there may be 50 hospitals that are declared ready, but I think they're going to turn to us as one of the first ones. So I think it's something that probably will stick with us. In other words, no matter what happens, it's going to stick with us.
You know, over the last year, I don't feel like we've slowed down at all. We've been sprinting, really, as we've been trying to really focus our efforts now on training the country and standing up that infrastructure. And so we started with training Ebola treatment centers that the CDC had named, and then of late we've really started focusing on those assessment hospitals, or those frontline folks who are going to kind of take those folks in the early phase of their care until they can get to one of those Ebola treatment centers. So I think, you know, it's no longer really about Ebola, it's about what's next. So there's going to be all sorts of novel things that occur in our lifetimes, unfortunately, that we'll need to have a plan for and prepare, and I guess that's really our mission at this point, to make sure that we're not in a position where there's only 3 places in the U.S. that can do that from now on. So I think we've turned from really being, you know, that expert clinical place to being that expert educational facility. It's very rewarding. I think every day we receive emails and requests for information, and like I received probably three just emails today that I need to answer of people who have attended our courses or are struggling through a situation and just want to know how to handle it. And having lived through it and done it successfully, we have that information to share.
We have a lot of faith in Dr. Smith, you know, and he's very much you know, loved by the staff. We admire him very much, and we trust him. Now, the day that we got the all clear and he had no Ebola virus in him, Shelly and I, we were out in the conference room, and we cried and hugged each other, and it was just so heartwarming to know, not just for our patient, but for our staff, that we did this. And we are not only educating our staff on how to take care of highly infectious disease patients, but we're teaching the city, the country, the world, really. And it's amazing. So yeah, my life has changed a lot. I just hope I can live up to it, because if it's not Ebola, it's going to be something else. You know, there are other diseases out there that, you know, we are prepared for, and so we need to make sure that the rest of the country, the world, is ready for that as well.
What we really try to promote when we go across the country is our interdisciplinary team. So we pull nurses and physicians from virtually every unit in the hospital. We don't just pull them from, say, critical care or infectious disease. We mix, and we feel like that gives us a really dynamic team that's able to handle whatever comes at them, because inevitably there's always someone in the room that has the answer to a new situation that arises. For me personally, I come out of a pretty formal laboratory training. As I said, I'm director of research, so that's predominantly why I was brought on. It's been really rewarding for me. I came to the University of Nebraska to be involved with the College of Public Health in an effort to have more of an impact on the public, as opposed to just a lab researcher where we're getting great findings, but you have to wait quite a while to see the impact play out for the public. Obviously, in the last year, what's been most rewarding is there's been a direct impact of all the research and effort that we've put in for the last 10 years that we weren't sure would ever be used. It was used, and it proved effective, and it had an impact both here in terms of the confidence of healthcare workers in our ability to treat these patients in the U.S., and also the lessons learned that were developed from our clinical teams here that could be passed along in West Africa as well.
The Med Center had a good way of getting information to the media, to the public, about what was going on. So I didn't really have to say anything that wasn't already public knowledge. So that was nice, because Nebraska Medicine really kept folks informed. So it was just a matter of people would be kind of like, oh, you're in there, wow, oh, okay, you know, and kind of reassuring them of that, you know, we're following all our protocols. It was neat being able to come in, be a respiratory therapist, work with other therapists, other nurses. We really worked to kind of help each other. We worked within our scope of practice. You know, we all have clinical licenses through the state of Nebraska, and so there's certain duties that are ours, but we crossed the boundaries that we could within our scopes to help each other, and that was nice.